This is a TalkStation original podcast.
Welcome back to The Senior Moment. You're listening to Lynn and Ryan from Carteret Landing, and today we have a special guest, Logan from Crystal Bluffs.
Thanks for having me.
Thank you very much. And so today we've spoken a little bit about independent living, what independent living is, and why you'd live there. And then we've had another episode on assisted living and what assisted living is. Today we want to talk about what is skilled nursing and rehab. What is long-term care? And Logan, being an administrator for Crystal Bluffs, is an expert in this area. So why don't you tell us a little bit about Crystal Bluffs first, and then break into what is long-term care?
Sure. Yeah. Really awesome you guys do this show, by the way. Loved being on it a couple years ago. I think it was the beginning of our pandemic.
It was the beginning of the pandemic. It was
stressful times, but I'm glad to be back. So,
well, thank you for coming back.
Yeah, love what y'all do. So, Crystal Bluffs, skilled nursing facility. We are right around the corner. Literally, we can almost see y'all.
Stone's throw.
Yeah, stone's throw. So, skilled nursing, a little bit different than what y'all do here at Carteret Landing. We've got two different sides to the facility. We specialize in rehab, and then we also specialize in long-term care like y'all do as well, but it's slightly different than what we do. So I'll go into both of those. I guess first, let's start with rehab. That's what we're really known for in the community. So our rehab, we offer anything from orthopedic surgeries that you had just recently had, planned or unplanned. We specialize in IV management. We specialize in specific dementia care. We specialize in wound care, a little bit more of the nursing services. So the definition of a skilled nursing facility is the care you receive under a licensed professional 24/7. We have nurses around the clock, we have CNAs around the clock, and access to a medical director, a physician around the clock.
How does therapy play in the rehab component of your community?
Sure. It's the most important reason why someone wants to come to Crystal Bluffs. They want to get stronger. They want to get back to who they were before whatever just happened to them, whether they fell and broke their hip. They want to get back to what they were before that fracture. And that's what we do. That's what we specialize in. And then we partner with the home health companies in this community to then further your therapy at home after you get intensive therapy with us.
And of course, just for those who don't understand what therapy is, there are primarily three types of different therapy: speech therapy, physical therapy, and occupational therapy.
Sure.
Of course, my wife is a speech therapist, so they're my favorite. But but they work on they'll work on some cognition issues, and if somebody has swallowing difficulty or speaking difficulties, they'll be working with residents on that.
Sure.
Occupational therapy does a little bit of the more fine motor skills, and especially on the upper body. Would that be kind of a fair assessment?
It's fair, sure. So physical therapy, I'll break this down in an example. Let's say you're trying to walk yourself to the restroom. The walking aspect is the physical portion of that. When you get to the restroom, how you use the toilet, how you would pull your pants down, etc. That's the occupational piece. That's the fine motor skills that Ryan was mentioning. So those two go hand in hand. And then a little bit more on the speech component, that is the cognition, more of your thought processes along with that. So they all three can be combined, but yeah, we provide all of those.
Are the rooms semi-private, private rooms? I mean, I remember my nursing home still had a quad. Luckily that I don't think that's very common anymore. But what are the rooms like that the residents would be staying in when they're coming for rehab?
Sure. So 99% of our residents come into a private room. They have their own bed, their own bathroom. Everything is private. However, recently the need has been so much, unfortunately, we've been having to admit to semi-private rooms because of the demand needing for skilled nursing services. But we have 36 all private rooms, so we've had a little bit more need than that recently. But
when it comes to the rehab component of Crystal Bluffs and any skilled nursing home, what are some different ways that people can pay for that, or how is that paid for?
Sure. That's something you need to start early as far as long-term care goes. But as far as specifically rehab goes, typically someone has a Medicare or a Medicare Advantage plan that you bought into at an earlier age. you would need a hospital stay to qualify for rehab. So for someone that's just at home that feels a little weaker, needs a little bit more assistance, you wouldn't qualify yet for a skilled nursing stay. A skilled nursing stay is only activated from a hospital stay, and you must have a 3-night stay in that hospital to use those benefits.
Is it just a 3-night stay, or do they have to actually be admitted to the hospital in order to be able to have Medicare cover that?
They do. They have to be admitted. There are some fine details that I'm probably not going to get into on this podcast, or we might need to have another one specific just to insurance and long-term care, rehab, and on the long-term side is it's detailed.
Yeah,
it is, and it's something that you need to start thinking about sooner rather than later, because when later comes, it's frustrating and it may be too late.
Hi, this is Lynn Schultz at Carteret Landing. We invite you to visit our beautiful assisted living community. Carteret Landing pairs exceptional, compassionate senior care with the stylings of a resort. Our beautifully appointed suites, common areas, and bright and engaging memory care neighborhood can provide you or your loved one with the quality living they deserve. Carteret Landing is in Morehead City, right behind the Friendly Market. Come by and see us today or call for your personal tour at 252-773-0980.
Hi, this is January Brown with Eastern Carolina Council, Area Agency on Aging, and you're listening to Senior Moment.
Welcome back to the Senior Moment with myself, Ryan, and Lynn, my co-host. And of course, today we have Logan from Crystal Bluffs on to talk about skilled nursing, long-term care, and Crystal Bluffs, where he is an administrator. So again, thank you, Logan, for coming on. We were going to start talking a little bit about making that transition from skilled nursing to staying at Crystal Bluffs long-term, or possibly if you are in assisted living, coming to Crystal Bluffs to live there long-term. What does that mean? What are the differences?
So when you're at rehab at Crystal Bluffs or another skilled facility, that comes to an end eventually. There are eligibility requirements with your insurance, and eventually rehab does come to an end. Then every family and every resident has to make that decision. What's next? Am I going home? What does that look like? Was I at a good place prior to whatever just happened, and why I am at Crystal Bluffs? So what does that look like? Do I have family support? Was I able to do the simple things in life that I need to do safely? That's the typical conversation that our social workers have with our residents and family members. And it's a collaboration between everybody. The resident has to want to require the safety and require help. That's difficult. Who wants to leave their home? I take pride in what we do at Crystal Bluffs. I'm sure y'all do too. But if I was my residents, I'd rather be at home where I grew up, down the street from
Absolutely.
my home, my friends, my
And
family.
where all my memories are.
Yeah, all my memories. So it's tough. It's very, very tough. But you do have to look out for your own health and your family as well. Most of our residents' family members work. I mean, I know that my parents, your parents, we're here working right now. So it's hard to take care of your loved ones at that setting. So you have to make that decision. You have to make it as a group effort. And there's no easy answer. I can't tell anybody on this podcast right now what to do. But I know that all three of us sitting here can always offer advice and to plan as early as possible.
A lot of times people are coming to you in an emergency situation, especially for a skilled stay. It's somebody's fallen and ended up in the hospital and now needs rehab. We've talked a little bit during the break and before the show about trying to do your research beforehand and how important that is. What are some suggestions that you would have? And like I said, I wanted to go to long-term care, but I thought of some more questions about skilled.
Okay.
And so when someone is touring, and of course the case manager at the hospital is giving them a list of the different rehabs that are available, what are some of the things that you would suggest that they be looking at when they come to look at your community or other communities or shoot any rehab community in the country?
Yeah. Number one is looking for friendly faces. Looking for people that care about what they do every day. That's what I pride ourselves on. We are a great facility. We're probably not the greatest in the country, but I think we are, and I think that's because of the people that we have. I remember our survey that we had a couple years ago, because we have an annual survey every year by the state of North Carolina. They made a statement along the lines of, y'all are good, we know that, but that's not what we see. We see that your residents are happy and that your staff members enjoy taking care of them. And that statement alone in the 7 years that I do this means more than the deficiency-free surveys, all the accolades you get. It's more about how your staff treat your residents. So when touring a facility, you can get a good vibe. You just can. So past that though, looking at the cleanliness of the facility, of course, looking at how the residents look. Those are things to look for. If you're there during a mealtime, look at a meal, of course, and then just look how people are behaving.
I think that's the most important thing. And we touched on that, talking about assisted living, is you've got to get that warm, fuzzy feel when you walk in the door.
You do, because that's going to be your home.
Yes.
Right. And that's and the same with when we spoke with Devin about independent living and making sure you want to see how people are interacting with each other, how the residents interact with each other, and how the team that works there interacts with the residents, and how they interact with other teammates.
And you get that feeling the second you walk in the
You
door
do.
by how you're greated.
Right.
Absolutely.
Right.
Starts right at the front door.
You do.
So when somebody can't go home, they're not able to return to an assisted living, what is that like in a long-term care community? What's that like at Crystal Bluffs?
Yeah. So I alluded to it a little bit before, but those are your tough decisions there. Rehab's not typically a tough decision because you're forced to do it. There was an episode that occurred. You're grateful to get in the nursing home, get your therapy, and go home. Long-term care is when you make that decision to stay for your foreseeable future and maybe forever at that point. So when you're going to a long-term care bed in our facility, what that means is it is away from our rehab unit, and it's more activity and quality of life driven. We're not there for long-term care to make you the best functionality of a person for occupational and physical therapy that we can be. Now, we do that. I don't want to take away from that, but that's not our primary goal. Our primary goal is that you're happy, that you have socialization, that you have dining room activities, that you're a part of our resident council board, and just developing those relationships and the things that you couldn't get at home. However, we do offer a lot of things as long-term care so basically like our transportation system that we have, that's a huge benefit to being in long-term care because there's no more doctor's visits that you have to struggle getting to. Long-term care, we provide that. We have our own podiatrist that comes in-house. We have our own dentist that comes in-house. We have our own audiologist that comes in-house. There's no more appointments that you have to stress over, and we have 24/7 supervision over your care. So we're taking your vitals every so often. We're taking your weight, where we can stay on top of those clinical things that at home is way more difficult to stay on top of.
What is the actual living like? Tell us about the activities the activities program and what's dining like within a skill or long-term care community.
Yeah, sure. So we play bingo like the rest of them. We try to be way more creative than that, but at the end of the day, bingo is very important, and we do that on a daily basis.
Well, we actually just had one of our residents who did a podcast a couple weeks ago, and she was talking about bingo and how important bingo is, and we said we don't go into when bingo's going on, we don't go to the activity room because we do not want to interrupt that.
That's right.
We had a huge department head meeting a couple years ago about, do we need to get away from bingo and do something more creative, and I feel like that we're just staying on an even kill. Well, that didn't work with our resident council, so we had to do bingo. But past bingo, we're doing resident activities every single day. It's holiday based, it's seasonal based. Right now we're outside a lot. We've got 2 great courtyards that we're doing tons of outside activities on. And we have 3 individuals in our activity department. They're all there full time, and they do a great job with our residents. It's getting to know each individual, what they want to participate in, and designing an entire program around them.
I'm so glad to hear you talk about that because I think there's such a stamina out there that you go to a skilled living community and that's it. So for people to realize everything you do and the continuation of life and thriving is so important.
Activities and food are top 1 and 2 and that's probably why Ryan just brought that up. But
Yes.
when you're long term, you're not as focused on the therapy side of it.
Right.
You're more focused on the activities
Yes.
and the dining.
Yes.
So a little bit about our dining, I'll go ahead and go into that. We do offer breakfast and dinner in our dining room every single day. We do a meal to service, so you're taking your order on a menu. We have somebody that brings your food to them. And then we have 2 individuals on our department that are in the dining room for any needs that you may have. I know that y'all have something similar to that here. It may look a little different. We typically have anywhere from 10 to 15 residents that participates in that every meal.
That's great.
And then now one of the differences is that you are able to accommodate a much more medically inclined diet versus when we're limited as to what we can provide. Can you just give a quick overview as to what kind of diets people can expect or could be put on in a skilled or long-term care?
Yeah, sure. So we have 4 to 5 different textured diets. So if you have swallowing difficulties, anywhere from a 1 to 5 level, a 5 would be, just a normal diet, and a 1 being more pureed if you have major swallowing difficulties and everything in between. So we have a licensed speech therapist, full-time staff there every single day of the week that assesses our residents for safety features of swallowing, because that's a huge concern when you live at the home setting and you don't have someone looking at those things every day.
And that's one of the main differences between assisted living and a skilled nursing community is that you have those therapists. We're lucky in that we work with agility therapy, but that's not a requirement in assisted living. So versus that is something that you're always going to have. Right. Having those extra trained set of eyes to be able to watch for the safety of the residents. Right. A major difference between assisted living and skilled nursing.
And even if you're not on your therapy caseload at that moment, we do quarterly and annual screens to make sure that any deficits are not there, that you're not declining, so that we can rehab up to your prior level of what you were. So we have so many processes in place to prevent that from happening.
Talking about another difference is the different types of team members that you hire versus what we have. So in our community and actually in assisted living, there isn't a requirement that you have an RN on staff. We're fortunate that we do have a RN that is here basically all week. She's on call 24/7. So we have a little bit of an advantage there. We just think that provides a higher and better level of care for our residents that live here. But what are the staff like at your community?
Yeah, so speaking just strictly on RNs, we have one every single day, at least 8 hours a day. That's what we have to follow regulatory-wise from the state of North Carolina. However, that's about to change and going to go to 24 hours per day. That changes next year. There's a long time until that, but we'll have an RN every minute of the day in the facility coming soon. But also in an extra to that is our medical director. We have a licensed geriatrician that's on site at least 3 days a week. And that's huge for us. Someone that's been doing this for 20 years, specializes in the geriatric population, and just knows our residents and patients, like family. Mm-hmm. She can go home right now, not pull up a computer, and she knows what medications they're taking.
Wow.
She knows their medical history. And that's a huge asset to us. It just benefits our residents.
Certainly.
So it brings that personal touch.
It does.
How about the rest of the team that's working directly with the residents? What are their certifications? Who are you able to hire to be able to take care of the residents within the community besides that RN?
Yeah. So of course we have CNAs. CNAs work directly with the resident to perform those daily living activities, such as taking your loved one to the restroom, helping them get dressed for the day, helping them get in and out of bed. Those are your direct primary caregivers as well. We also have licensed practitioner nurses, practical nurses. They are a 2-year nurse from a community college, and I have some of the best ones around. You know, there's a big stigma against the RN versus LPN community that LPNs can't do what an RN, and I do understand that an RN has to go through further education, but I've got some of the best LPNs I've ever worked with that can run circles around anybody in healthcare. So they're a huge part of our success. But past the nursing care, we also have 2 licensed social workers in our facility as well. One designed for our short term and one designed for our long term. And they both have bachelors in social work from 4-year accredited schools. So they're a huge asset to our community too, because they work with our family members. We touched on it earlier, how difficult it is to have a loved one placed for long term or to have that acute situation for a loved one placed in short term. Those social workers are advocates for families and for the residents and patients.
What are some of the ways that we talked about Medicare or Medicare replacement plan when you're there for rehab? Just an overview of how are some ways to pay if you're going to be there long term?
This could have another podcast for that. We'll start with Medicare specifically. Like I said earlier, Medicare is activated from the hospital setting, 3-night stay. That is how you use that benefit for a short-term rehab stay. Medicare or a Medicare Advantage plan such as Humana does not pay for long-term care. That is only for short-term rehabilitation. So then your long-term care is out of pocket, private pay, such as what y'all are, or also you can get Medicaid services. Medicaid services is through the state of North Carolina and through the county that you live in. I don't have any guidance on that, but that is how the majority of our residents pay for their stay at Crystal Bluffs.
We on the last show we suggested if anybody has questions about Medicaid, they need to go down to the Department of Social Services, and they are the they are the experts.
I said the person writing the check is the person you need to talk to.
That's correct.
So what have I forgotten to ask you? What are some things that you would like to point out or that just need to be covered when somebody is thinking about moving to a skilled nursing community long-term care?
You hit on it earlier, but come ask for a tour. Come talk to us. Don't wait until it's too late that you need that placement immediately. Have some plans. Talk to members of the community about their loved ones. Everyone's had a loved one go through the geriatric stage of their life. So whether that was in an assisted living, whether if their health declined slowly or quickly, and just their experiences through that. So just talking about it, us working in healthcare, we understand how things are. We understand the transition between care. We understand what to expect. That's not most of the world. So hopefully this podcast gives awareness to members of this community and whoever will listen to this about what to do and what not to wait for.
At some point, most people are going to need to visit at least the rehab part of a skilled nursing community. So I completely concur. It is really important to include skilled rehab as one of your tours. Independent living is wonderful. Assisted living is wonderful. But don't forget to go visit a skilled community because you want that to be a part of what your plan is and something that you've already spoken to your family about so that when that is needed, you know that if a bed is available at this place, this is where I want to go. Well, Logan, I really appreciate you coming on today. As you said, hopefully those who are listening have gained a little bit of insight that they might not otherwise have had before our half an hour together. And we wish you the best.
Absolutely. Thanks for having me. Feel free, everybody, to reach out.
Here.
Come by, stop by, come see us.